I got a chance to see this machine he was working on, got tested on it. It blew me away. I thought he was a genius, what he's doing. I actually sold to, I was a pharmaceutical rep early in my career, and with that career, I met a lot of healthcare practitioners that were struggling with certain things about even how can they earn more money in their practice. This test is not even going to let them earn more money in their practice, but it's going to allow them to do really great work by testing HRV early. So I'll let Dr. Andrew Holman, genius in his field, tell us a little bit about himself. Please, introduction to and medics. We're so excited to learn more about it.
Thank you, Richie, and I'll send you I'll pay your invoice when you. Thank you for the kind words. It's a tough business. I'm a rheumatologist, so I'm board certified rheumatologist, take care of autoimmune diseases, and I had to solve my own problems. I had patients in tears and.
Dr. Holman, hold on 1 second. Blue Honda Pilot, if anybody has that, it has to be moved. It's on the side, it's blocking one of the deliveries. If you have a blue Honda Pilot that's near the dumpster, please move that right away. It's blocking one of the deliveries. They're gonna tow it. Thank you guys. Sorry, Dr. Andrew.
Yeah, so thank you. So I'm an immunologist. If you, I hope none of you have to see a rheumatologist. They call us the consult of last resort for a reason. We do very sophisticated diagnostics to try to sort things out. I was the fellow who figured out how dopamine runs a very serious problem called fibromyalgia. And then I retired after an exit, but it taught me some neurology, which is not what you expect as a rheumatologist. And it taught me about stress. And at the time, 20 years ago, stress was being considered very important for affecting your immune system. And patients knew it, doctors suspected it. We didn't have anything we could do about it because we didn't have a blood pressure cuff for stress. We didn't have a blood test for stress. Cortisol was not good enough. So basically what we found is the consumer brand, Whoop, I watch Whoop here and so forth, see what they're up to, and they do the best they can, and they teach a lot about something called heart rate variability, HRV. And it's a normal human rhythm in your heart where your heartbeat changes when you breathe. It goes a little faster, a little slower. But when you're under stress, it disappears and the heart becomes a metronome. So there's a way to use a cardiovascular evaluation to measure this brain function called the autonomic nervous system of the stress response. So it got everybody's attention in medicine, and it got my attention when I found in sports they had a remarkably effective new mathematics out of Eastern Europe that was coming to the United States. So over here is the FDA cleared cloud HRV 5-minute test done at the doctor's office. It's covered by insurance. We're raising our last $5 million just to scale this up and to make 500 of these and get them out there. This is something that nearly every doctor, this is not hyperbole, wants in their office. Not just a revenue stream because they get paid to do it, but it helps us be better doctors. Patients tell us stress matters. We believe you. We don't know what to do about it. We don't know how to quantify it. Now you can. And with predictive precision that's been shown in clinical trials. So I could quote all these trials to you.